we know it works. We can see something very close to it right now in Amsterdam. But it's when we get to the heavy-duty, the psychedelic drugs like LSD and peyote and things like that, we realize that we can't necessarily treat them like the same kinds of commodities to be sold in vending machines or grocery store counters or advertised on billboards, that we need institutions capable of dealing with this. And I think perhaps the failure of our drug policy in the past has been the failure to provide institutions such as users clubs, for example, where people could go to become introduced and educated in psychedelics, where they could be screened, where if they had adverse reactions, that users co-op would take care of it and provide the appropriate setting for training people in the use of these very useful, inspirational, but also sometimes dangerous substances.
Really seems to be developing at a great rate, and having elements in there of medical research, I think, is a really necessary component to it, and it broadens the other arguments. It's not at all the whole picture at all, but I think that that kind of study isn't being done by governments in normal places that would normally do that, and we need to create our own institutions, our own organizations, and so this has been an effort to try to see, can collective action produce, and a lot of productive outcomes and enlightened discussions, and it can. So then there's a lot more that it can do. So I think you could really consider the possibility of joining CalNormal and joining MAPS and joining groups that are
drugs. I don't mind public money going to something to benefit drug users. For instance, I think it might be a great idea for us to fund rooms where people can sit and talk, rooms where people can have other options. But the most important aspect, I think, of supply is to supply people services, including drugs. Less criminal justice, less prevention, more reliance on people's individual choices.
On that list by, while receiving federal money, writing a pamphlet called Just Say What, in which I talk about the possibility, distinct possibility, of controlled drug use, who are being taught to be loyal soldiers in the war on drugs. And I want to reiterate what other people have talked about, and that is that the war on drugs has made me a liar in my own home, and for reasons I would really not like to lie about. I'd like to see that changed.
Okay, some sound bites. I'm John Beresford. I'm a psychiatrist. I live in Canada. First thing is, this is the 50th anniversary. It's brought us together. Let us stay together. Second soundbite, I'm a psychiatrist. I don't think LSD should be restricted to the use of psychiatrists or doctors. I think anyone has the right to use it and should have the right to use it. What was the third?
The hardest, intellectually hardest problem, I think, facing American drug policy is how to make the psychedelic for their beneficial uses to people who can get benefit from them without increasing use under dangerous conditions and abuse. I don't think anybody regards a couple of million 14-year-olds trying acid as I know a little about, which is the problem we now have, and I do think it's a problem, with the quantitative drugs, if you will, particularly heroin and cocaine, the drugs that influence people who are on average a little darker than the people in this room and a lot poorer.
My name is Stuart Regis. I'm here representing the Libertarian Party. Something of a homecoming for me. I live and work in D.C. now, but about 10 years ago I did many hits of MDA at a club here in San Francisco, dancing all night long at a place called Trocadero Transfer. And I used to teach at Stanford University until I wrote some taunting letters to Bob Martinez, and he ordered that I be fired. Actually, something that I never shared, something I never shared with the media at the time that I thought you all might find interesting is that I was fired for claiming to have carried illegal drugs in my backpack, and I never quite said what it was that I'd carried.